The nerve cells in the brain that die in Parkinson's disease are traditionally viewed as being depleted of the transmitter dopamine. However, these cells in fact are referred to as melanocytes, or a type of cell that are very rare and have a very special application in limited areas of the brain. In these areas, the two chemicals melatonin and dopamine exist in chemical opposition. From the day you're born to the day you die, the object of these two chemicals functioning together is that they remain in balance. For example, during the day, dopamine is up while melatonin is down, while during the night, melatonin is elevated and dopamine is down, and they are linked together to keep in balance. When Parkinson's disease occurs, the link between melatonin and dopamine is broken, and while disengaged, dopamine levels are reduced dramatically, whereas melatonin is increased. And as the disease advances, the relationship between these two chemicals becomes further and further out of balance. When we treat the disease with dopamine replacement, dopamine levels are elevated to a point where they again return in balance with melatonin. However, over several years, the event of wearing off may well occur, whereby the amount of dopamine that's taken to treat the disease no longer approximates the amount of melatonin that exists, and therefore dopamine and melatonin come out of balance once again. In dyskinesia, or where the patient shows excessive uncoordinated movement, excessive dopamine replacement would again elevate the dopamine levels to a point where they are much higher than the amount of melatonin which exists naturally. What we have shown in our work is that if you antagonize melatonin through various methods, then this again brings the relationship between dopamine and melatonin back into balance. We have done this with various drugs that we have developed, such as ML23, but we can also do it effectively in many patients by using light. In summary, the work we have done in both the laboratory and the clinic clearly show that treatment of and recovery from Parkinson's disease is most effectively achieved when melatonin and dopamine are kept in balance.